Therapeutic plasma exchange or plasmapheresis or plex. The three terminologies students are getting a bit confused. A procedure commonly used in dialysis units. Plasmapheresis, especially in a tertiary care center. First, we will understand the terminology or decode the terminology. Plasmapheresis. Pheresis is separation. In the blood, you are having plasma and formed elements, the red blood cell, WBC, platelets are there. If you are separating one component from the other in the blood, it is called as pheresis. Plasmapheresis means we are separating the plasma. Leukopheresis, we are separating the leukocytes. Thrombopheresis, we are separating the platelets. Commonly, separation, plasmapheresis means from the blood component we are separating the plasma is called as, terminology is plasmapheresis. The short form of which can be called as plex. There is no clear-cut definition when to call it as plex. It is a short form. The plasmapheresis plex. The plex can be used as a short form for therapeutic plasma exchange also. What is this therapeutic plasma exchange? We are separating the patient's plasma from the blood. We are replacing it with some other plasma. When we will do? Whenever there is a disease in the patient plasma. Whenever there is disease like antibodies are present in the plasma. In the blood, antibodies are present. You separate it. More is in the plasma, the antibody. We want to remove the antibody. In which condition you want that? One example is anti-GBM disease, anti-glomerular basement membrane disease, Goodpasture syndrome, Guillain-Barré syndrome, cryoglobulinemia, antiphospholipid syndrome, and so on. In these conditions, the antibodies are there which is causing the disease. So we want to remove the antibody. Antibody half-life can be as high as up to 21 days. As short as 5 days, as long as 21 days. But if it is already creating the disease in the patient, it can't respond to the immunosuppression. We have to remove it. How to remove it? We have to remove the plasma. We have to remove the plasma and we are replacing it with good plasma. That is called therapeutic plasma exchange. That is why in the terminology, either in Harrison or in the standard textbook, sometimes they use the terminology plex, sometimes they use the terminology therapeutic plasma exchange. Sometimes, commonly they might have used the word plasmapheresis is being used. So these words are a continuum. Plasmapheresis means we are separating it. We are exchanging it or not, that is up to us. Most of the time we have to exchange it for the disease purpose, treatment of the particular disease purpose. That is the terminology. Plasmapheresis is a broad category in separation. Therapeutic plasma exchange, TPE, means we are replacing it with some other patient, some other donor's plasma, or we are replacing it with albumin. Whatever the replacement may be, we are replacing it with some other fresh plasma. Plex can be used as a short form for this also, this also. That is why even in our dialysis unit, there is a board which says plex. In the first in the dialysis unit, we are having the machine where we commonly use that particular machine for plasmapheresis, where the board will be written as plex. Means in that particular bed we are doing that procedure. That is why plex is the common terminology we use. How it is being done? There are two methods. One commonly used in the blood bank. They will take the blood, rotate it, centrifugal method. Another one is using the plasma filter. Now you can see the image. One image will come in the video. Here you can see it is similar to the dialysis. Blood will be taken from the patient. Similar to the dialysis, this machine will pump the blood towards the plasma filter. There blood will go inside. Plasma will be separated. The rest will be returned to the patient. Since we have removed some amount of plasma, for example 1.5 liter of plasma we have removed, we will be replacing it with a donor plasma or albumin. That is the yellow and green color. The replacement will be given filter. Plasma filter looks exactly similar to dialyzer. Exactly looks similar to dialyzer. The plasma filter separates the plasma. We are replacing it with a new one and returning to the patient. So this is therapeutic plasma exchange, or we can call it as plex. Since we separated plasma from the blood, it is called as plasmapheresis. So in the image, I think you get a clear idea. Some medicine residents are getting confused. Plasmapheresis, where it will be done? It will be in the blood bank, or ideally for many a times in coagulopathy you will be giving fresh frozen plasma. Those are the things we will be giving. That will be done from the blood bank, from the donor. Centrifugation will be done, then the part will be taken and given. But for therapeutic purpose, mostly we will be doing in the with the help of the dialysis machine in the dialysis unit under the nephrologist or the critical care specialist. Anyone can monitor it, and plasmapheresis can be given. The mission-based plasmapheresis using the plasma filter is the preferred choice in cases of removing the antibody and replacing it, especially in sick conditions like Goodpaster, Guillain-Barré, these syndromes. So this is the idea when you use this terminology, and in the dialysis unit we do commonly this procedure. So this is an intro for this. Bye bye.